There are two words that can make a doctor sound extremely reassuring. Those two words are I know. I know what's happening. I know what this ECG means. I know what that treatment this patient needs. Patient wants to hear them. Families wants to hear them. And if we were being very truthful, doctors enjoy saying that because medicine rewards certainty, right? Nobody spends years studying, training, taking multiple exams, and being questioned by seniors to eventually declare and announce that actually I'm not sure. No, that is not what people like to say. And yet, the longer I practice medicine, the more suspicious I've become of absolute certainty. Because sometimes the most dangerous person in the room is not the person who doesn't know anything. Rather, it's the person who no longer believes others can also know better. Hello, everyone. I am Dr. Vamshidhar Argula. I am an emergency physician, and this is CODEBLUE Confessions. And today we are going somewhere. Today we are going somewhere patients rarely see. Behind the qualifications, behind the titles, behind the confidence, we are walking into something medicine doesn't particularly enjoy discussing, which is intellectual elitism. Medicine is a hierarchical field for a good reason. Experience matters, training matters, expertise matters. If I am critically ill, I don't want 12 people conducting a democratic elections around my bed. Rather, I want someone who is competent to make a decision, to perform a procedure. The problem is not expertise. The problem begins when expertise becomes superiority. And medicine can be remarkably fertile ground for that. Think about our world, okay? Degrees after names, specialities, super specialities, subspecialties, academic positions, publications, institutions, years of experience, titles, consultant, senior consultant, professor, head of the departments. They are all very legitimate achievements. I'm not denying that. But occasionally, somewhere along that climb, a dangerous equation develops, which is I know more than you. Therefore, your voice matters less than my voice. Anyone who has worked long enough inside hospitals has probably seen some versions of it, definitely. A junior doctors, as a junior doctor, when you begin to present a case or presenting an idea, and that gets interrupted in a halfway. For example, a nurse says, Doctor, something does not look right, but immediately that nurse gets dismissed it without looking. Someone asks a basic questions during rounds, and instead of receiving an answer, the person receives humiliation. And occasionally, the most powerful argument in the room becomes this line: I've been doing this for 30 years. I've been in industry for 30 years. I've been in this field for 30 years. That's experience, and experience deserves to be respected. True. But experience is not an immunity from being wrong. Physiology does not care how senior you are. Pathology does not care how senior you are. And ECG does not become embarrassed and suddenly changes itself because a professor has entered the room. Disease has absolutely zero respect for hierarchy. It is we who respect hierarchy, but the disease does not respect hierarchy. And intellectual elitism has another interesting feature. It often disguises itself as teaching. There is a huge difference between saying that's incorrect, let me show you why, and making someone feel stupid for not already knowing it. One produces a better doctor and the other produces a quiet doctor. And quiet doctors can be dangerous because the next time that resident notices something or identifies something wrong, he or she hesitates. The junior doctor hesitates, the resident hesitates. And the next time that nurse finds something wrong, she wonders whether speaking is worth the humiliation. And now your ego is not it is your ego is not just unpleasant. Your ego is not just toxic. It has entered the patient's safety zone. I worked with very senior consultants who could dismantle your clinical reasoning in 3 questions. They're brilliant people. They're absolutely wonderful consultants and physicians and surgeons. But the best among them possessed something even more impressive than their intelligence, which is they made you feel comfortable enough to disagree with them. Imagine the confidence required for that. Say, for example, a junior says, "Sir, I'm not convinced. Sir, I'm not convinced with this procedure. Sir, I'm not convinced with this antibiotic. Sir, I'm not convinced with this analgesia." And instead of hearing a disrespect, they hear information. Those are the seniors you remember. Those are the seniors that hold your hand and show you the right path. Not because they constantly demonstrated how much they knew, but because everybody around them became smarter. Everybody around them felt comfortable asking questions. Everybody around them felt comfortable disagreeing with them. Then there is another opposite version, the senior whose opinion becomes the final diagnosis because the patient has finished becoming ill. Nobody challenges, nobody questions, everybody nods their head. And eventually, the room contains several intelligent people, but the intelligence of only one person is permitted to talk. That's not expertise, that's intellectual monopoly. I'm sure we all have encountered such situations. And before this starts sounding like I am standing outside the problem pointing fingers, I'm not. Seniority arrives quietly. One day you are junior, one day you are the junior who is afraid to speak. And years later, somebody is afraid to speak with you. That's the uncomfortable part. You may not even notice your designation changes, your experience grows, people begin asking your opinion, and slowly your confidence can become somebody else's silence. So perhaps the real test of becoming senior is not how much do I know. It is, in fact, what happens when someone tells me I'm wrong. Do I become curious or would I get offended? Medicine needs intellectual confidence. I want confident doctors. I want decisive consultants. I want people capable of saying this is what we are doing. But the strongest confidence I've encountered in medicine usually leaves a door that opens unless I'm missing something. Those four words can transform a team because suddenly the resistance can speak, the nurse can speak, sorry, the resident can speak, the nurse can speak, another consultant or co-consultant can disagree openly, and the patient gains. It is ultimately the patient who gains. It is the patient who gains from the intelligence of the entire room. Perhaps wisdom in medicine is not reaching a point where you can finally say, I know. Maybe it's reaching a point where you can say, well, this is what I know, and then take a pause. You can also say, what am I missing here? What am I not seeing? Because the moment knowledge makes us impossible to question, knowledge has stopped being our greatest strength. It has become our blind spot. Well, I am Dr. Vamshidhar Argula. This is Code Blue Confessions. And what is today's confession? The smartest person in the room is not always the one with most number of answers. Sometimes it is the person who is secure enough to hear another one, who is secure enough to listen to someone who disagrees to them. Until next time, life whispers before it screams. Pay attention.